wan shanga pibaro kibashitong bat ibakia junken.
Sorkar pdeng kala pynkhreh mynta ban ithuh bat pynbna no yaka North Eastern Indira Gandhi Regional Institute of Health and Medical Sciences Neigrihms kum ka Institute of National Importance INI yaka nila pyntip da Myntri ka tnad ka Koit ka Khiah ka sorkar pdeng Dr. Mansukh Mandaviya haka shithi sha Myntri ka tnad Animal Husbandry and Veterinary ka sorkar Jylla Bah AL Hek.
The letter that has been written to you from Neigrihms informing about.
No, I have written
from
Dr. Mansukh.
No, I have written the letter to Honorable Union Minister Dr. Mansukh Mandaviya on the 18 October 2023. Requested him to upgrade the Neigrihms to Aiims model. And also we have copied to the Honorable Prime Minister Shri Narendra Modi ji. So, yesterday I received a letter from Dr. Mansukh Mandaviya ji, which has responded to my letter immediately, that which had told that for the upgradations of Neigrihms to Aiims, so there is no proposal at present in the Neigrihms hospital, but the Neigrihms immediately will be upgraded to INI, Institute of National Importance. It is under the consideration of the Ministry, Government of India, Health Ministry, Government of India.
So what will be, according to you, the benefit, if Neigrihms is being declared as an...
So many super specialty facilities will be there. Then the employees also, those are working there now, right from the specialists, super specialists, the MBBS, general MBBS, they will be retained there only. Because the security will be there for the employees. Not only them, all the employees also. It will be immensely benefit to them. But what it is declared as the Institute of the National Importance. It is almost same as Aiims only.
It cannot retain doctors. Many of them are left for good opportunities in other states, especially Assam, and we have to suffer because of lack of doctors.
That I fully agree. They cannot retain it due to many lack of facilities. One is because has not been given that kind of status or Aiims status. The facilities has not been given to them. Number two, the Neigrihms hospital also, they have requested me at least to give them land, and also they will purchase land, not free of cost. The land in Shillong, in New Shillong, for the doctors, all the doctors who are serving in the state of Meghalaya, like what they have given to the bureaucrats, IAS, IPS officers, but not the same rates of land, but a reasonable price also be given to them. At least it can be retained, all the doctors in the state of Meghalaya. See that IAS, IFL, I don't say that they are not serving the state of Meghalaya, they are also serving the state of Meghalaya, but after retirement, there is no longer services given to by them. But a doctor throughout their life, whether they are in service or retired from the service also, they will be able to give services to the people of Meghalaya. So that's why we is the most important to retain a doctor in the states.